Hospitals and clinics across the country have been turning away some of the nation's most qualified healthcare workers at a time when they're desperately needed. NBC's Aaron Gilchrist has been looking into this, and he joins me now. We're talking about veterans. They've served as medics, and then they come back into civilian life. They're not getting hired?
Yeah, it's all about paperwork. The civilian healthcare world needs to see the papers, the licenses, the certifications, and rightly so. I mean, they need to have those things to show that these folks have experience. But you have Army medics and Navy corpsmen who develop all this great experience in the field, and they just don't want all that experience to be ignored. As an enlisted sailor, Eric Dodson spent 11 years in the U.S. Navy, trained as a hospital corpsman, working on the front lines, assisting with surgeries and mass casualty incidents.
And it was, hey, we have like 20 people coming in, take care of some, like find someone to take care of them.
After his military service, Dodson volunteered as a registered nurse at a COVID field hospital in New York.
Once that was over, because the mission had finished, I was applying for jobs as an ER tech and being told I wasn't qualified.
Did anyone ask about your work experience, your life experience?
A lot of it was very much, hey, this is an impressive resume. We love this. We'd love to have you, but, you know, you just don't have the right certifications.
Dodson's problem is not unique.
At a time of great need for healthcare workers, we're turning away some of the nation's most qualified, experienced healthcare workers.
According to the Call of Duty Endowment, only a handful of states have clear pathways from military healthcare to civilian healthcare jobs.
And you're confronted with these bewildering regulations. And sometimes a lot of these folks just give up and they find other careers, which is a real shame.
The military has found a way to address this problem. Now all enlisted medical personnel come to one place where they learn, they train, and then they're able to take those skills and certifications into the civilian world.
Colonel Richard Villarreal is the Dean of Academics at the Defense Department's Medical Training Campus.
Tactical field care. Let's go.
Over time, we've realized that it's better if we can provide each individual soldier, sailor, and airman with something that they can take out to the civilian community once they have finished serving their country in the military.
The military now provides these certificates and even college credits that transfer into the civilian world, too.
They at least have a pathway using one of these bridge programs.
The military shifting to help veterans help more people here at home. So we're seeing the help come from the military on the front end. We have these nonprofits who are trying to help vets find jobs and make sure that they can sort of at least read through some of the red tape. But they say it's really going to take the people who write the regulations to change some of the rules to at least try to see all of the experience.
So where does that land? Whose responsibility is that to write those regulations?
So if we're talking about EMS, for example, if someone wants to be an EMT, there's a hodgepodge of rules all over the country, different rules in different places. There's the basic National Registry certification that these EMTs need in most places, but it's not the case in every place. And so it's just they need to sort of cut through some of the confusion or eliminate some of the confusion.
This is crazy. We need people who have the experience. They're there, and we can't figure out a way to do it. There's got to be a way. Important reporting. Thank you so much, Aaron. We really do appreciate that. Aaron Gilchrist.